Action Report 4.1 is the proposed plan and seeking approval on COVID-19 layered mitigation measures for this school year to be reconsidered to see if necessary or with adjustments for the upcoming year. So that's last board meeting on the 7th. I had shared with the board and the community that there was many unknown variables, but that despite the uncertainty at the state level, despite the uncertainty with court cases, executive orders, and all of those matters, despite the lack of clarity that was present in terms of how do we move forward, that I did think that we should reconvene. And so that's exactly what this action report tonight is all about. So I want to visit some of the background and rationale. I'll try to answer some of the questions that were presented. I think our union, AFT union president, Renee, and also our parents who have spoken this evening and at previous board meetings, and also parents who have reached out, staff members who have reached out. I think the comments that were shared this evening kind of beautifully summarize the difference in perspectives, opinions, input, concerns, and just beliefs about how do we best navigate this and move forward. And I will be very clear, the sudden change that came with the ruling in the TRO and some of the wider implications that were not as expected as it pertains to the specificity that we would think would come out with a temporary restraining order specific to plaintiffs. There was wider implications based in there. There was a great range of legal interpretations and a variety of other complex factors that, as prepared as you are in expecting what is to come about, you can never be fully prepared on how that is going to materialize and then what those response options could be. So you're right, every district has navigated those differently, and I do expect additional changes to come as developments come along even further. So what was spoken tonight at the podium does represent the wide range of views and opinions on this matter in total. And at the last board meeting, I shared that despite the uncertainty and kind of the lack of clarity in how we move forward, we do have a local responsibility to continue to visit this, revisit this, monitor this, and respond. And that's exactly what I am proposing that we do. Bottom line, we have the responsibility of maintaining a safe learning and work environment. We need to have the ability to respond to lessen, increase, or remove measures based on the conditions. And we need to begin to bring some clarity about how we move forward, given that that is not being presented to us in any way, shape, or form at this point in time. Could it come in the future? Yes, perhaps it may. But as you can see, there's a great deal of variance now in how local communities are figuring out how to navigate kind of this next phase of something that we've been all in for the past 2 years. So this is the bottom line, and I've said it before and I will continue to say it many times. Safe learning and work environment for our students and staff, continuity of learning, and support for those in our learning community. We know that at any juncture, after 2 years of what we've dealt with, a transition is going to be difficult. We know that people are going to have varying levels of comfort and concern and just have their own path forward as how their family works through the transition. For every family that was elated for the change that came about, there were families that were scared, that were anxious, that were, just had very serious concerns, staff as well, medical concerns. What we do know though, is that we do have the shared responsibility and collective charge to continue to navigate this together. And I don't know that there is a perfect answer, a perfect solution. We don't know that. But what we can do is continue to watch it together, be responsive, and do our best to work through it. Over the past 8 school days, I think what our union president described is very accurate in terms of the range of emotions that students and staff and families are feeling and the range of responses. But what I can tell you, despite bumps in the road or individual concerns that are needing very special individual attention, our students, our staff, and our families are doing the absolute best we possibly can with this situation. And I have stressed respect and importance and continuing to stick together through this, and that's what we have to continue to do. So I know it is in the board's purview to, through board policy, have a plan or direct the superintendent to have a plan to respond to all types of emergencies, be it communicable disease or some other type of pandemic response plan. And so there is board policy that is present that does support us in moving forward with having a plan, and if necessary, adapting a plan to respond. Because if anything has shown us over the past 2 years, I guess the trajectory of how COVID will evolve or kind of eventually fade or kind of rear its ugly head again is very much unknown. And I think there's been times before where we felt that lull and then things continued in another direction. So at the very least, I think that we have to have a position that we will monitor conditions, we will respond if we receive different guidance, if we have indications that things are changing the community or having a strong impact, negative impact, that we will respond. So those board policies that I referred to in terms of pandemic preparedness, management and recovery, communicable and chronic infectious diseases, do allow the board to authorize a plan to be developed for procedures for maintaining staff and student wellness inside of the school community. At some point in the future, COVID will kind of fall into that category that if it shows up in the schools or it shows up at a certain level or there's a cause for concern in terms of an outbreak or transmission happening in schools, much like many of the communicable diseases do that we are traditionally vaccinated against, we do work with the health department and we do respond. The direction from Will County Health Department as of February 6th, when we had our last meeting on February 7th, was to continue to have a plan of layered mitigations in place. And we don't yet know how that will evolve, or as many have used the terminology, what is the exit ramp or what is kind of that on and off ramp for where we stand. It's a very interesting place to be right now with the lack of clarity and guidance about how to manage now and how to manage into the future. And so with that said, this may not be the perfect plan and it may require modifications in the future, but it's a start to ensure that we do communicate to our community that we are in a very good place right now in terms of case counts internally inside of the district, and I'll show you those in a moment. And in terms of community transmission that we're seeing in positivity rates in our immediate zip codes. But if that begins to change, that we will consider all of the variables and how that is impacting the school environment, and if necessary, increase the mitigations or kind of stay where we're at or decrease or lessen in the future. So what we know is that yes, we are continuing on with the layered mitigation strategies that we have in place now, and we will continue to do that. We are letting our families, our staff know about vaccination opportunities in the community. We have a clinic here at Lukanzik Middle School in Romeoville on Sunday. We are still having staff and students stay home when they are ill with COVID-like symptoms or any other illness, because that's one of our best measures that we can take to keep our school environment safe. We still are following isolation in alignment with CDC guidelines. And we are still promoting hand washing, respiratory etiquette, cleaning, sanitization, high level of air quality and ventilation as recommended by the professional organizations, and testing for symptomatic students with parents' consent. To the extent possible, we are still distancing as well. The two additional layered mitigation strategies right now that we have to figure out where we stand as a district and how we will respond. One is some communities as a whole, or for the most part, are very comfortable with saying, we don't ever want to hear that word again. We don't want you to take any measures. We don't care. We're just going to kind of charge through, and despite whatever happens in the future, we're going to endure it. And then the other kind of opposite end of the spectrum is that we will take the highest level of measures, masking for kind of eternity with no end in sight, despite what is happening in terms of the number of reported cases. And I think both of those are extremes that I know people feel strongly about. But in reality, the conditions are changing, and it is evolving in the sense of what we know now with the trends that we're seeing with transmission in school, with the public guidance or lack thereof. So we are continuing to figure this out, much like everyone else is. So the other alternative that we are pressed with, if we have no plan in place, even an imperfect one, if we have no plan in place and we start to see rising numbers and transmission in schools, and we don't have any ability to begin to respond to that, I never want to return to a place where adaptive pause or remote learning is the go-to. Although it may still be necessary in limited situations for short period of times, it is something that we want to avoid at all costs, right? It's kind of like a last measure resort. So as I mentioned earlier, and this was published 48 hours ago, so the community health metrics with the zip codes where it says 5.13% positivity, it's actually even lower as of today. It's at 3.22% positivity rate for our immediate zip code. So that's a good sign. In terms of our cases in district, we have, as of the date of this publishing, 5 current staff cases and 8 student cases district-wide. So just to put this into perspective, the majority of our buildings, and I just checked the dashboard just, earlier, like within the past 15 minutes, the majority of our buildings have 0 reported student cases. A small number of buildings have 1 reported staff case, and a small number of our buildings have 1 reported student case or 2 reported student cases. So overall, internally in Valley View School District right now, we have a very low % of known cases as a percentage of the population. This isn't to discount that individuals could spread that virus, that other individuals could be impacted severely by having exposure. That I do recognize to be a very real variable for many individuals. So where we stand right now, we are currently in a place of masks recommended. We are recommending masking. In most of our schools, we do have a higher level of masking by choice by individuals, but yet we are still working together through that, as many of the comments have shared with you tonight. And it is a process. Everyone has different levels of comfort with that, and they're working through that transition the best way that they possibly can. We right now, based on this plan, would continue to stay at this level with a period of time of recommended masking. Sustained level, into one of the earlier comments of when does this kind of like go away, a sustained level at minimal transmission at this level here in kind of the blue, the level 1, would cause us to shift our position to optional or masking not required. And I think over time, as people grew comfort with that idea of not masking or made that personal choice for themselves or their families, that we would see fewer individuals continuing to choose to mask. But I do think that we will have some individuals that will continue to mask for probably the foreseeable future, or they may choose to mask in certain settings, at crowded events, on transportation, public transportation, on an airplane flight, for example, on a school bus. And some of those will continue to be present. As determine how we came up with the metrics, we did look at our data, and our data is publicly available on our website. We have looked at our data over the past 2 years in terms of known reported cases inside of the district for students and staff, and in terms of the community threshold for positivity rates as defined over time. We looked at where we saw surges after periods of holiday times. We looked at where we saw the largest impact to the point where we had to consider remote learning, to the point where we were concerned with attendance, staffing. There was significant impacts. And so we did develop a kind of layered, kind of tiered approach to looking at these metrics. And we would consider both of these, because community transmission could be like an early sign to us that there's more cases in the community. We should be on guard. And then also looking at our individual schools, programs, and classrooms is important as well. We have had cases this school year, even though we've been in person the whole time, where we have had to have a classroom or a smaller self-contained program shift to a short period of remote learning. to address a concern in that area. Level 2 would essentially be kind of an increase when we saw those rates beginning to climb. We understand that these metrics are not going to apply in every single community, and we understand that a lot could change. As testing declines in the larger community, that would have an impact on the positivity rate. So we have to be aware of that. This may need to change. As we see maybe less individuals getting tested, more individuals using home tests, if we see new variants that are not detected by the current tests that we have, all of those are things that we don't know what exactly that is going to look like. But they are things that, with guidance from our county health department and with carefully monitoring what's going on inside of our district, we will be able to determine how we can respond. So do I think this is a rock solid plan for the foreseeable future? No, I absolutely believe it's a starting point to offer some safety net, some reassurance to our community, to our staff, to any individual who has some concern that we are just kind of throwing everything out the window and we're not going to keep an eye on this at all. And we would not be willing to take measures to keep individuals safe if concerns rise, or to keep our kids in school. And that has to be our ultimate priority here. That is my charge. Safety for those who learn here and work here, and keeping our kids together in person where they belong with us in school. So in this level of situational masking, we would consider the setting, we would consider what is going on in that particular area. There is a comment here about targeted use of situational masking for our younger populations. For example, our children under 5 who do not yet have the vaccine available to them, or in certain situations, perhaps when we were in larger settings or transportation, for example. So I understand that you do not see this as a black and white plan, and it's not intended to be a black and white plan, because I do not believe that we can predict all of the different scenarios that will evolve. But we do have to have an awareness. If we are seeing increasing numbers and we have an population, for example, our littlest learners in the district who do not yet have access to the vaccine, that we do give that population special consideration and consider increasing mitigations for that group. Now, I know everyone has a different opinion on masking, everyone has a different opinion on vaccination, but for every family that feels very strongly against that, we have many families that feel very strongly in support of that and do want that reassurance for their little ones, and do want to know that we will continue to monitor this very closely, and if necessary, increase the support or the mitigations for children in that age level. Universal masking is at a place where we would see a significant increase in positive cases or in the community level of transmission. Again, these metrics are not foolproof, but they give us a start of having a target of what we would see as a percentage of our total population inside Valley View with cases reported, as well as in the greater community. And this is where we would say, if our only option to help get community transmission under control or help to stop school transmission would be to mask up universally for a set period of time, that we would do that. Because the alternative would be to ignore it and pretend it doesn't exist, or to go immediately to remote learning. And I don't feel that, ethically, that either one of those is a viable option for us to take when we are charged with the well-being of more than 15,000 students and their families, and more than 2,500 staff and their families. So again, this is not an exact science, you're right, because the science has not yet told us what this looks like or what the future of this is going to come. There's not even agreement, when does this kind of really switch from pandemic to endemic? And we are still in full pandemic response, but we do know conditions are changing. And we do know at some point there is a path forward. At least I'm very hopeful at some point there is a path forward. And I do believe there is. So I'm asking the board to approve the plan as presented, as authorized by board policy that allows the board to do so, to charge me with having a layered mitigation plan in place, to continue to monitor this very closely for the remainder of the school year, into the summer, and to make adjustments as necessary if guidance changes, if there does become a more direct path that is provided by community health or public health agencies, and or any other directives that come along. And most importantly, in addition to that, of what is going on inside of our learning community. So our learning community has weathered this recent change, but I think this is the next step in ensuring that we continue to carefully and responsibly monitor the conditions and then move forward together, because I know that's what we all want. At the end of the day, that is what we want. We all want to be in a place where our worries about what they should be for our kids, for teaching, learning, support, for keeping a strong community, because that is what our kids need and deserve. And that is our true charge that we are all here for in Valley View School District.